What are the misconceptions about varicose veins? One of the most important misconceptions about varicose veins is that these visible veins are perceived as nerves by a lot of people, and they go to neurologists and get neurological treatments. These are very, very far from nerves. They have nothing to do with nerves. They are not nerves. And anybody who's giving pregabalin for varicose veins, both the doctor and the patient is doing injustice to themselves. This will not reduce with pregabalin or any of the neurological medicines. This is a clear case of varicose veins. These are visible veins, and the right person to treat this is a vascular expert. Number two is that once the skin below the knee joint becomes dark, they think it's a dermatological problem, and they keep on going to dermatologists and they keep getting ointments. This is not a dermatological problem. In fact, even in dermatology literature, this is called stasis eczema or venous eczema. That basically means this is secondary to varicose veins. So varicose veins have to be treated first, and then if necessary some ointment can be put, but generally putting Betnovate and some steroid ointments is extremely dangerous because it thins the skin there, reduces immunity locally, and can cause more infections and cause more damage. So ideally you should not be putting any ointment on this, but if you have to put an ointment, then you'll have to take a vascular consultation before you put the ointment. Please don't give general dermatological treatments to this leg. Then third misconception about this is the ulcers. Once ulcers form, they think something bit them or some injury they got or is because of sugar or something. It's not. This is because of varicose veins. So because of varicose veins, you have to treat the varicose veins first. By just doing a skin graft, putting artificial skin there and all, you're doing more disservice. This will not heal. It will not only not heal, it will also fail. The skin graft will fail because the leg is walking. So the skin graft will fail and cause more damage. So this is very, very important to understand that this venous ulcer should be treated by the same vascular expert who's treating your varicose veins, because they are in the best position to decrease this problem. And this is very important to understand that there are a lot of misconceptions about it. One more misconception is that before laser ablation came, we had surgical stripping as a method of choice. And when surgical stripping was done, it used to fail very often. It has a 60% success rate. So there's another misconception people that, oh, there is no treatment for varicose veins. That's very far from truth. Varicose veins can be very easily treated. At Avis Hospital, we do about 4,000 varicose veins procedures a year, and almost all of them have excellent success rates. So it's a complete misconception to think that there's no treatment for varicose veins. And the last misconception is that socks works for all varicose veins. Stockings don't work for all varicose veins. Stockings is only temporary. It is not a curative thing. If you wear stockings for early varicose veins, yes, it's justifiable. But delayed varicose veins, advanced varicose veins, stockings will not work, and they do not work. India is a very hot country. If you wear socks unnecessarily, it causes a lot of sweating inside and causes more damage than good. So it's a misconception to think that stockings work for every varicose veins.